Welcome back to the show. Make sure you're getting this entire show commercial-free, as well as the bonus show and access to our almost 6-year archive of David Pakman Show programs. Go to davidpakman.com/membership and sign up today. This is the time to do it. And I know I haven't discussed it for a while, Lewis, because I'm frankly a little bit embarrassed about it. But Lewis is up to 3.5 million memberships at this point. And it's really, I mean, the guy can't stop. And
I'm an addict.
He's an addict and by far has the most memberships of anybody, probably ever. I can't think of anyone in any context ever for any membership program that has had 3.5 million memberships.
Yeah. Well, I don't think anyone's going to top me at this point. I feel pretty safe with 3.5 million.
Would you spend 6 months uninsured to qualify for affordable health coverage, Lewis?
Risky. I don't know.
There's a program called the PreExisting Condition Insurance Plan, or PCIP, and so far only about 18,000 people have signed up across the country. It's a lot fewer than the administration expected, and there's about 25 million Americans who are uninsured. About half have some kind of pre-existing condition, according to the Department of Health and Human Services. The idea is that you can sign up if you have a pre-existing condition. However, you have to have a 6-month period where you don't have insurance. And obviously many people say, you know, because I have a pre-existing condition, I just can't afford to be without insurance for 6 months. It would be kind of like playing Russian roulette. It's really a chance I can't afford to take. Now, would I spend 6 months uninsured to qualify for affordable health coverage? I don't know what affordable health coverage means. In other words, I have health coverage now, and I can afford it.
You consider it to be affordable.
And I consider it to be affordable. I think a better question would be, let's say a national healthcare system was put into place. Would I spend 6 months uninsured in order to qualify for that, or to be able to get on that if those were the requirements? You know, it depends what pre-existing conditions I had. Right now, I would say, yeah, you know, I would chance it. This is a point where I'm relatively healthy, knock on wood, and I would say spending 6 months without insurance, that doesn't mean that I'm saying I'm guaranteeing I won't need any care. Hopefully, I just wouldn't have anything so major in those 6 months that I can't just pay out of pocket for it. I would go with that in order to get single payer, universal government provided coverage after 6 months. I would do it right now. If I had a pre-existing condition, it's very hard to say. How expensive are those 6 months going to be? It's a tough question, but the fact that people have to make these decisions and are put into these positions is really what's wrong with the system.
Yeah.
So elaborate a little bit, Lewis. What would you do? Talk me through it.
I mean, anything can happen. You could get into a car accident and be in the hole tens of thousands of dollars, maybe $100,000.
Right. It's not even the type of thing of, are you going to get some kind of disease? It's, are you crossing the street and some nut comes flying around the corner?
Yeah.
It's very hard to predict.
It's very risky. If you don't leave the house very often, maybe you'd be more likely to do that. You have to weigh your risks, I guess.
But so what, weigh them? I mean, it's been a while since you've last been to the doctor, right?
It has, yeah.
So what if someone said to you, listen, spend 6 months without any health coverage, and then you'll be able to buy in, it'll be $25 a month for the rest of your life. I don't know, just to throw something out there. Would you say, yeah, I'm going to go the 6 months without it?
I probably would, because I feel like I'm in a position right now that even if something bad did happen, it wouldn't completely ruin my life.
I'm kind of in the same mindset. If I was given that opportunity now, I would probably do it.
So I guess, yes, I would.
I would want to hear
I wish someone would give me that offer, too.
The new poll up on davidpakman.com is that, would you spend 6 months uninsured to qualify for affordable health coverage? Define affordable, whatever affordable means to you. And if that means it has to be a no-cost single-payer plan, we'll answer the question that way. davidpakman.com.